Again, thank you everybody for coming. We had no idea we'd see so many people out here tonight. Tonight we are fortunate to have Dr. Daniel Ragland and Dr. Faye Dixon here tonight to talk about understanding schizophrenia and ADHD. They both have backgrounds from PhDs in clinical psychology from American University, and I'm sure they'll tell you a little bit about themselves too. Dr. Ragland is an associate professor of psychiatry and behavioral sciences at UC Davis, the Imaging Research Center. And then Dr. Dixon is a clinical psychologist at the UC Davis Mind Institute.
Okay, well, thank you all for turning out. This is a much better attendance than I ever get in Sacramento, so doing well. And I'm going to figure out this remote system. And what I'm going to do very briefly, we've been encouraged to give brief presentations so there's a lot of time for questions. And I'll be talking about schizophrenia, and then my colleague and partner, Faye, will talk about ADHD. And so what we'd ask you to do is to save your questions until both talks are given, and then we'll open up the floor for any questions or comments. And I really do want questions and comments because I'm just going to very briefly touch on a little bit of the neuroscience, touch on a little bit of this new work in terms of early identification and intervention, and then really just hopefully pique your interest so that there'll be lots of questions that we can answer. So we're going to begin by talking about just a brief definition. I know there's people from NAMI here, so there's many people in the audience who probably understand this illness very well. I'll provide a brief definition and then focus on what my research has been on, is how it affects cognition and why that's important. Show how we're imaging the brain to understand where things are going wrong, and then end by talking about this new early intervention program. And I'm still figuring out this remote. All right, here we go. Okay, so schizophrenia is defined by its symptoms, and it's identified now as a brain disorder. It's not because you have bad parenting. There's no such thing as a schizophrenogenic mother. It's a brain disorder that affects people's ability to perceive, understand, and interpret the environment. It occurs about 1 out of 100 people worldwide. And there's a genetic component, so if one of your children has the illness, there's a 10% chance a sibling will have the illness. And the most strongly genetic it is only a 50% concordance rate for identical twins. So if you have two twins that share exactly 100% of their genes, if one is affected, there's only a 50-50 chance that the other will be affected. So clearly it's genetic, but it's also environmental. And fortunately, the field has moved a little bit beyond nature versus nurture and understanding nature and nurture. This illness affects function, both socially and motivationally. One of the real difficulties is that as a result of the symptoms, people begin to withdraw from their social environment, and they just lose motivation to function in the world. It's classically defined with behavioral symptoms, both positive and negative symptoms. The positive symptoms are the ones that get the most press and are most impressive. They're things like having auditory or visual hallucinations, seeing things or hearing things that aren't there. But also there are negative symptoms where individuals have lack of social interest, often look like somebody who has depression, lack of enjoyment in life. And these negative symptoms are less responsive to treatment and are kind of a pervasive problem in the illness, even once you treat the hallucinations and delusions. The other thing I should have up here, which I'll talk about, are the cognitive symptoms, which also tend to be enduring and not respond well to treatment. Women have a little bit better course of this illness. The onset's a little bit later, and their outcome is a little bit better. And when you talk about pretty much any brain disorder, women look a little bit better than men do. Genetically, you can see from this concordance rate that it's quite complex. It's not something like a simple recessive gene, where there's no single gene that explains this illness. It's analogous to something like heart disease, where you have a family history of heart disease, and it means that some people will have a very strong history. No matter what they do, they're going to have a heart attack. Some people have a history, and if they exercise and eat a good diet and maintain their weight, they're never going to have a heart attack. So there's this genetic complexity and environmental complexity. And some of the most interesting research going on now, molecular research, is talking about gene-environment interactions. And neither one is determinate. They very much interact. So the effect on cognition is what my research has been on. And this is based on just a simple paper and pencil neuropsychological battery, where you have a bunch of paper and pencil tests divided into different functions. So this might be abstraction, attention, verbal, facial, and spatial memory, language, spatial ability, and sensory motor ability. And healthy subjects are here on the 0 line. This is unimpaired performance. And then we go down to about 3 standard deviations below the mean, where you can see if it's a person who has the illness or a family member that's unaffected, who does not have a diagnosis. If you're on this spectrum, there's impairment across these cognitive functions. Sometimes the impairment is only mild, and within a standard deviation, you wouldn't really call it an impairment. But there are certain areas that are more impaired than others, and the area of memory functioning is the area of greatest impairment in many studies of cognition. So it seems like there's a generalized dysfunction in cognition, and there's a more specific dysfunction in memory. Also, sometimes people see it in attention and frontal lobe function. The memory problem in schizophrenia is very interesting because it's very different from the way we normally think of memory impairment. I think most typically people think of Alzheimer's dementia, where you have somebody who might have some trouble learning information, but they learn what they learn, they then forget. So you can ask them, 15 minutes later, and they have no recall of what they remembered. This is the same kind of amnesia that you would have with somebody who has damage to their middle temporal lobe from a severe car accident or a stroke, where the information just can't be consolidated and stored. The information is lost. And in schizophrenia, it's not really an issue of losing the information. It's an issue of not learning it efficiently. Because it's not organized and learned efficiently, it's difficult to retrieve. But what individuals do learn, they remember. So this is an example of a list learning task called the CVLT, where healthy subjects are blue and affected individuals are in yellow. And you can see that across measures, patients are worse than controls. But the interesting thing about that task is the words can be organized into different categories. So there's items that are spices, there are items that are fruits, there's items that are clothing items. And so as you do the task, if you start to group together similar items, it helps you organize your learning and improves retrieval. And that's the semantic organization strategy that healthy subjects do very well, but patients don't. In contrast, you can just learn the list in order, and you tend to remember words at the beginning of the list and the end of the list, and you just use this kind of passive rehearsal strategy, which patients do fine, but that's a much less efficient strategy. So they're not learning the information in an organized way that facilitates retrieval, but they're not forgetting, which is illustrated in this graph, where you have the patients in red and the controls in yellow matched on immediate recall of either stories or designs, and the amount of forgetting over a delay is the same between the two groups. And as I think you'll see, this characteristic of the memory impairment is much more hopeful than the characteristic of memory impairment that you would have in Alzheimer's dementia, where you have lost the information.